Hello, and welcome to the Early Childhood Health Consultation February webinar. This webinar stinks, all about poop. My name is Maria Morgan, and I'm the project manager with Early Childhood Health Consultation. Our team is so excited for you to be joining the webinar today. Next slide, please. Our program is in partnership with the Wisconsin Department of Children and Families, housed at University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program's mission is centrally focused on supporting Wisconsin ECE or early childhood care providers and focused on promoting best health and safety practices within their programs. Our program's vision is for a sustainable, eventual statewide model working through health consultation and centrally focused on promoting the health and well-being of children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to a partnership to improve tailored support and best meet the needs of each tribal community. Our program offers general guidance on best practices for health and well-being in early childhood settings. Any questions about a specific child should be directed to that child's primary care medical home. For today's webinar, we will begin with an introduction, have centralized content, time for question and answer, and a few closing remarks. If you are interested in receiving continuing education credit with the Wisconsin Registry, we invite you to stay tuned until the end of today's live webinar, where we will include a post-webinar survey link in the Zoom chat. That link will be where you can enter your registry information if you're interested in continuing education credit. Also, if you are interested in reading up on the webinar recording, resources, and slides, you can expect a follow-up email from us about a week after today's live event with links to the webinar recording and slides. There are a few different features we'd like to highlight in today's Zoom live webinar, including the chat and the Q&A. If you open up a chat, you are welcome to send questions or comments and use the drop-down arrow to send them either to the hosts and panelists or to everyone. You also can send your questions anonymously through the Q&A feature by checkboxing Send Anonymously. And with that, I'd like to turn it over to our program director, Dr. Dipesh Navsaria.
Good afternoon, everyone, and thank you, Maria, as always, for your capable introduction and for making all this happen. And thank you all for being here today. It's a delight to see you all online. And I have to say, I always like the in the chat when you folks say hello to each other and do a little introduction. It's nice to have that ability that doesn't work so well if we were all together in a real room and with a limited amount of time together. So let me just, okay, so today, this webinar stinks, all about poop. We're going to talk about what one finds in diapers. We're going to be discussing, things about consistency, smell, size, texture, color, all those sorts of things. We'll understand what actually stool is, what actually constitutes poop, and how to know what we should or shouldn't be concerned about. And then some ways in which early childhood health consultation can be a resource for you. All right, so I'm just going to get it out right here at the beginning here. There's no way I could not write these slides and not include, yes, indeed, the poop emoji at least once. So we'll just go with that. I will also say, with the exception of one picture, there are no pictures of poop in this for the most part, because one, I don't think they actually add a whole lot to the conversation necessarily. But number two, if any of you are eating lunch or anything like that, you probably would prefer not to have images of poop appearing on your screen over and over. So let's start off with the basics of poop. And first of all, I'll just say it's funny kind of listening to language, especially when I'm talking to families from other cultures or other languages and hearing what they use. Poop seems pretty common, right, in the U.S., especially when we're working with younger children, and it's not considered a word that you'll get in trouble for saying at work. So we tend to go with this. So first of all, let's start off by talking about what actually is poop, right? What is this thing that we all produce, and and where does it really come from? And the way I like to think about this is that the digestive tract, we put a lot of things in at the front end, right, in the mouth, food, beverages, etc. And really, poop is a combination of what's left over that the body was unable to digest for some reason. Okay, it was just a part of a food or something that could not be digested. And also in there is stuff that the body has produced. For example, there's digestive acids, bile acids is the term we often use, that are also part of poop. And then it's also things that live in the digestive tract that are making their way out, like bacteria. In fact, it varies all over, depends on which study you read, but as much as 40 to two-thirds percent, 40 to 66% of poop is actually bacteria. And this is not a bad thing. Most bacteria are supposed to be in there in your gut. They actually can help with digestion. They actually make a very important vitamin that's involved with clotting, called vitamin K. So you actually want those bacteria there doing the things that they're doing because they're serving an important function. We'll come back to the bacteria in a little bit. There's an interesting sort of question here, right? I think most of us would say, poop is produced inside the body and then you poop it out. Right? Well, it is inside the body, but in a sense, it's not. So let me explain what I mean here. Um, the it, the things that are not digestible stay in the digestive tract and they come out the other end. They don't enter the body proper in the sense that they don't go through the bloodstream, they don't make their way into the kidneys, et cetera, et cetera. Yes, it is inside the body by one definition, but in another definition, it's actually something that never really made it into the body in some cases. So this is why, like, if a child swallows a small, quote unquote, safe plastic toy, um, right? It's not toxic or anything like that. You have a good chance that you're going to find that plastic toy in the poop because their body can't digest it. They don't absorb it. It just comes out the other end, or a coin or something like that, right? So it never really gets into the body because these are things that can't be broken down in the way that we are typically thinking of. It's not particularly useful for us to all know, but I thought it was a nice philosophical point to kind of just think about that it's not the same as, for example, injecting something or to something we'd give through an IV or things like that. All right, let's go to the big question that most common question that comes up from early childhood educators, people coming into clinic, et cetera, et cetera. Color. What color is normal? Well, there's a whole series of colors that are fairly typical, right? So the ones we usually see, brown, yellow, green, okay? Sometimes this is driven by age of the child. Yellow is much more common, for example, in infants. Many have that kind of mustardy kind of look to them. Um, wherein once they get a little bit older and start eating a broader variety of foods, you see more of the brown and the green. But often, yeah, it's a function of what they're eating, of what someone is eating. And as we'll talk about, it's also a function of just things going on inside the digestive tract that we don't actually have a whole lot of control over. So that's what we typically see: brown, yellow, green, all fairly normal. Possibly concerning colors. Please note my use of the word possibly because there's all sorts of reasons that these can happen. Tarry black stools consistently. Happened once, probably not a huge deal. But if you're seeing consistent tarry black stools, that can be concerning. That may be a sign of internal bleeding. Why is it black? It's because the blood has been digested partly and causes that black color. Now, are there other reasons to have black stool, including something that they ate? Yes, there are. So again, don't panic, but that's something that would certainly make me say, huh, what's going on here? Red is also a concern, maybe. If you're seeing red and it looks like blood, particularly if it's clotted blood or flecks of blood or something like that, um, blood in the stool, especially over a longer period of time, should not be normal. Okay. And that deserves a conversation with the child's healthcare provider, like family should take them in, and some evaluation as needed. Now, there's other causes of red. There are very common causes of red. Often, if they are drinking a beverage that's colored red with some types of dye, some kids, not all kids, we don't know why, that dye will stay in the digestive tract and then they come out with red stool. There's occasionally things, there's an antibiotic, very common, called cefdinir or Omnicef. And in some kids, again, don't know why it's not all kids, but some kids, it can actually cause a red stool color, and it's harmless. It's not doing anything bad. It's just there. Again, possibly concerning. All right. Blue, purple. Yeah, they probably ate a crayon or something. I don't know why I would see blue or purple otherwise. That's probably something that they ate. Maybe it's food coloring in something. Maybe it's a crayon they ate. Who knows why, but those would be extremely strange colors to see. Maybe they ate some Play-Doh. They're strange, but again, these are generally harmless sorts of things. And then I get asked about this a lot, oddly. White stool or very, very, very pale stool that's almost white. Um, I'm typically, so the thing that we worry about in healthcare, and if you go and Google white stools, right, this is the thing that will make you panic, is like, oh my goodness, they're having some dysfunction in their liver and, they need to be rushed for evaluation and, or they have a hepatitis or something like that. Yes, yes, it could be those things. More commonly, though, it's not. It's maybe something else. Illness can cause the gallbladder to not produce as many of those bile acids we talked about, which are a big contributor to that brown or green color. So it may actually be some other illness that's in play. It can also be something that got eaten, right? That again was just imparting that white color and so on. It's one symptom is the point I'm trying to make here, and it's not something that I would automatically say, oh, this is a big problem, but it's part of a bigger picture. If it happens once, I'm not sure I'd chase that down. If you're noticing it as a regular thing, by all means, please, please, please suggest that this child be evaluated by their regular primary care provider and let them figure it out from there. So yeah, those are the common colors. If there's a color that I haven't mentioned that you don't think there's a reasonable explanation for, please feel free to ask. So let's move on now to texture and smells. And this is a very interesting philosophical question as well. When do loose stools stop and diarrhea begin? And I actually started asking this question. You can argue this was maybe my very first encounter with, I'm putting this in air quotes, with early childhood health consultation. Um, it was when my own kids were in preschool. This was in another state, and excellent center that we went to. And my son got sent home a lot from the toddler 2 room, I think it was, or maybe it was toddler 1, for diarrhea. And the thing is, we never saw diarrhea at home. It was now he had some loose stools. That's because he loved eating dried fruit, and some of the sugars in dried fruit and fiber can hold on to more water in the digestive tract, and it leads to looser stools, right? But that's not an illness. It's not anything wrong. It's just simply something that happens. So yeah, and we were like, okay, what's going on here? And I actually ended up asking one of my colleagues, I said, is there like a legal definition of diarrhea? Because I don't remember hearing this in medical school or PA school or anything. And the answer was, well, no, you just kind of know it when you see it. The answer is diarrhea is a truly liquid. There might be some small solid bits in it, right? But it's basically primarily liquid. Um, Whereas loose stools, again, can be affected by what's being eaten in numerous ways. So texture tends to not tell us as much as we'd like, unless it's true diarrhea, just completely liquid, or you're seeing very hard stools, just going to the other end of the spectrum. And we'll talk more about that in a few moments. But if loose stools alone, especially if they're contained within the diaper, no other issue, kid seems to be acting fine, is not an illness. It's not a symptom necessarily, right, of anything. It may simply be related to something they ate or some changes in their digestive tract or things like that. All right, smells or gas? My goodness, I get so many questions from parents about this. And often, like, if a child passes gas and man, it does not smell so hot, people will come in as if there's something really wrong. Now, sure, I would say most kids don't tend to have particularly stinky gas that they're passing, but I don't see adults doing this. And for the record, I'm glad I don't want adults running into for healthcare because they had a pass some smelly gas once. Um, but it's sometimes viewed as a problem or something to be fixed. And the first question is, where in the world does gas even come from? Okay, let's talk about that for a second. There's two ways. One is that it can be swallowed air, and that usually doesn't get too far in the digestive tract. So that's what often leads to a need to burp, right? Because you swallowed some air, and the fastest way for it to get out is, for it to burp. This, by the way, you might remember back to other webinars or to our podcast. This is why it's not actually an automatic necessity to burp a child. Some kids actually swallow very effectively and efficiently that they may not have much air to burp up, you know, and they'll burp when they need to. They don't necessarily need to be helped. At the other end, since very little of that swallowed air necessarily makes it through the whole long digestive tract, then where's that coming from when you are passing gas at the other end? That is largely gas produced by the bacteria. There, we talked about the bacteria. Well, here they are. As they multiply and reproduce, some bacteria produce gas. It can be dependent on what food they have available. So what's that stuff coming through that didn't get digested earlier? All that can lead them to produce gas. And that's why gas comes and goes. It may be something you ate. So I'll give you a very common one that I think many people are familiar with, which is beans, right? Beans tend to make us gassy. Why is this? Because there are particular small sugars, disaccharides in beans that we can't digest so effectively. So what happens is that bacteria end up being able to digest that down there, and they digest it and use it and multiply and produce gas as a result. And now you have a gassy person. If you break down those sugars by a product like Beano or one of those other ones that you can throw into your um, on top of your beans, then the bacteria won't multiply and you won't get as much gas because now the body's already absorbed those things further up because it could digest those. Another example, and I'm giving you this example cautiously, and I'll explain why, is lactose. Okay, lactose is a sugar found primarily in milk. It has two parts to it, and the body needs to break it into those individual parts in order to absorb it. Um, there's many of those two sugar things, disaccharides as we call them, that our body can break down. Our bodies, as adults who are not of European heritage, which is much of the world, um, don't have the enzyme lactase that breaks down lactose, the sugars. So what happens is those sugars stay in the gut and they get down to the large intestine, and the bacteria say, "Oh, awesome, thanks for sending us the food." And they break it down, and all between the lactose kind of keeping water in the gut and the bacteria multiplying, you get gas, you get loose stools or maybe even more liquid stools. You might get some cramping as a result because of the gas being produced, et cetera, et cetera. It's not harmful, it's just uncomfortable. And this is why using things like lactase enzyme, which is one of the brand names out there is Lactaid, or buying milk that's had the lactose pre-digested, like the uh, Lactaid milk or things like that, um, reduces or eliminates the risk of that happening. Now, I said that I was being careful about giving you this reason, and let me explain why. People often come in saying, I think my young child is lactose intolerant. For a young child to be lactose intolerant is very, 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 very rare. It's almost unheard of. Many people will lose that as they get older, further on in childhood, years down the road, or as teens or adults. But there's lactose in breast milk, right? So kids aren't lactose intolerant except in extraordinarily rare circumstances. And I've had parents self-diagnose that their kid must be lactose intolerant and buy really expensive milk that they didn't actually need, and so forth. Uh, so again, it gets lactose intolerance gets blamed on a lot of is blamed as the reason for all sorts of things in young kids, and it's almost never the case. But bottom line is, people come in, why is my kid's, gas so smelly? Why are they so gassy? Just it's what's going on in the digestive tract, and it's usually not a problem to be solved. There's not much we actually can or should do about it. It's just something that will, no pun intended, it's something that will pass. Yes, the jokes that one can make in this sort of topic are endless. All right. And I also want to mention colic, right? Colic is one of those things that people talk about a lot, and we're not really sure what the heck it is. Um, People will often say, well, it's gas related or it's something about the digestive tract. They make colic drops that like simethicone drops and so on that basically don't do a whole lot of anything. I personally don't think colic has anything to do with the digestive tract. I actually think it's a neurodevelopmental process where this is not a talk on colic, so I won't go on about this, but I think it's actually reflective of a child's ability to take in the world around them is moving faster than their ability to process what they're taking in, and it becomes overwhelming. And I think that's largely what ends up being what we note as colic. That means what you're feeding your child, drops for gas, et cetera, aren't going to make much difference. Those drops are harmless, but they probably do nothing, and they do cost some money. So, hence, I tend not to advise that people use these sorts of things. All right, here's the one slide involving poop. And this is something that I'm just showing you so you know what it is. Please do not hang this up or memorize it or anything. We talked about liquid stool, hard stool, et cetera. Believe it or not, in healthcare, we have a scale called the Bristol Stool Form Scale. And they identify like 7 types of poop. And this is something that people will note in their patient notes if they're talking about poop. You see type 1 up there, see separate hard lumps, they say like nuts, all the way down to type 7, which is entirely liquid diarrhea. Okay, again, you do not need to worry about this. Do not sit there sending home reports about type 3 diarrhea, type 3 stool, or whatever the case may be. But it just gives you a sense of kind of how healthcare thinks about the variations here. We don't actually even use this much in primary care. It's most of our friends in gastroenterology, the GI docs who end up talking about that. So, all right. Now, I'm glad some of you are asking questions in the chat about constipation because let's go to the other end. We talked a lot about diarrhea, we talked a lot about gas, et cetera. Let's talk a bit about constipation because this comes up all the time with young children. You know that, I know that. Okay, first of all, brief periods of constipation are normal. All of us experience constipation at some time, unless we have an underlying condition that's keeping us, more towards the loose stool or diarrhea end of the scale. But in general, right, constipation happens, and often we don't actually have a good reason as to why. Like, why did I get constipated? Sometimes, yeah, okay, didn't eat enough fiber, You're eating, a lot of food that tends to be more constipating, right? Um, Cheese often is blamed for, creating constipation or things like that, um, et cetera, et cetera, et cetera. But it's okay, right? Brief periods of constipation are normal. Okay, you either get it out, or you might take something to help get it out. But again, we don't need to medicalize it, right? In children or adults, right? We can say, hey, this happens. What what you put in to the person into an individual's mouth is different from day to day. And even if it's largely consistent, what's going on inside the digestive tract can also change, leading to different types of stool. Now, long-standing constipation in a young child, and there's some exceptions to this. There's some medical conditions, etc., but again, they're not common. Most of the time, long-standing constipation is actually not a problem of the gut, right? Of the GI tract. Believe it or not, that's the case. It's actually a problem of the space between the ears. Yes, folks, I'm talking about the brain, okay? This is something, the medical term for it is functional constipation. It means everything's functioning okay, but there's still constipation. And here's what happens. And some of you may be familiar with this, but this is really, really helpful to explain to parents because then it puts their mind at ease and helps them actually be able to help their kid. So you got a little kid, let's say they're a toddler, I don't know, 18 months, and they get constipated. And it hurts when they poop because let's just say that constipation was pretty bad. All right, now what? Um, you or I, we know that if we're constipated, we got to get that poop out, right? Like you can't just wait it out, right? Like, you got to get it out. Little kids don't know that. Little kids say, it hurts when I do this, therefore I shouldn't do it. So when they start to feel that hard stool, they hold it back. They go, no, don't poop. And what happens when you keep on holding on to that poop? It gets harder because now it's sitting in there. It starts to dry out, right? And then finally, when they can no longer hold it because there's all this poop behind and the urge is too strong, they poop out this hard, rock hard, dry stool, and man, does it hurt. And what do they think? Aha, I was right. I shouldn't poop because it hurts. And they get into this cycle, right? They're just trying to avoid pain and discomfort. That's all it is. So the solution to this is we need them to forget that it ever hurt to poop. And since we don't have a magic technology to kind of remove that memory from their brain instantly, what we need to do is wait till they forget. So what do? We give them mild laxatives. We do things like Miralax and others to help them have soft stools for so long that they forget that it ever hurt to poop. And eventually you can taper off the laxatives. The problem with this approach is that I find that it's often given to families without the explanation that I just shared with you. And then they come in finally after the fourth, fifth, sixth, whatever visit and say, I demand an evaluation. I want to see a specialist. Something's wrong with my kid, and people just keep giving me laxatives. They're not understanding that it's actually about pain avoidance because no one ever told them, right? So we all can play a part in helping people understand that and all. So I see this happen all the time in urgent care. It happens in primary care. GI specialists hate having to get those referrals because they know what the answer is. And basically, it's just about education. They don't need to see a specialist for it, and so on. Mind you, if the constipation goes on really, really long, like, sometimes we're talking years, then a specialist might need to get involved because there can be some long-term changes. But for the most part, it's about aiming for that soft stool. And we always tell families we're aiming for ideally one almost like pudding consistency soft stool a day. If there's more than that, awesome. We don't want them to be getting diarrhea and having accidents, of course. So if that's the case, you can dial back the laxatives a little bit. But yeah, we're aiming for that one pudding consistency stool a day. And that can go on for weeks or months of giving that laxative, and that's okay. We're waiting for them to forget. That is entirely the purpose of how we're handling that. I see a couple of questions in the chat that I'll just handle right now since they're related to constipation. is there a relation between any lactose-containing product and constipation? There usually isn't. There may be other things about the product, right? Some people find that milk itself can make them constipated, but that's not the lactose. That's a problem. It's other parts of it that might do that. Again, if you are not lactose intolerant, like many people of Northern European heritage, as an adult, then you'll digest it just fine, and there shouldn't be any difference there from the lactose. If you are lactose intolerant, that includes myself, as someone of South Asian heritage, then not taking anything or using a lactose treated product can cause actually diarrhea rather than constipation. Gentle Ease formula seems to cause constipation in many of the infants, is one of the comments there. Is that normal? It may be. Gentle Ease and things like that, they've taken some of the proteins that are in milk and they are digesting them. They're pre-digested before they're given to the baby. The idea being that if they're having some trouble digesting that, it's easier for them. Remember that almost anyone can buy Gentle Ease. You don't need a prescription, so it's not really a medical formula in the same way. Yeah, there may be a little predisposition to constipation there, but it can be very individual from baby to baby. Can medicine cause constipation? Yeah, depends on the medication though. And again, if it's a common cause of constipation, if a particular medicine commonly causes constipation, hopefully families are being told that when the medicine's being prescribed so that they can be looking out for that. I'm usually giving people the advice in the other direction, like, hey, this antibiotic might cause diarrhea more so than typical, and so on. It's not so much the constipation thing. And I see a question about infant poops. You are reading my mind because that is the next slide here. So infant poops, my goodness, they just go all over the place in terms of frequency. There is the infant who will poop 8 times a day, 9 times a day, and that's normal. And then you get the infant who might not poop for a really long period of time. And sometimes they're all breastfed. Like sometimes, we often say exclusively breastfed babies sometimes will not poop for very long periods of time. And yeah, but then I've also seen exclusively breastfed babies who poop a lot. Who knows why? The thing is, something we come back to all the time in these webinars and on our podcast is, how's the child acting, right? If they seem to be happily feeding, growing, doing all the things, the frequency of poop alone is not a huge issue. But yes, it can be crazy long periods of time. It's not unusual for an exclusively breastfed baby to go a week without pooping, and that's okay. That's actually okay. I think the record I heard about, at least that anyone was looking, might have been close to 3 weeks. That would make me nervous. That's extraordinary. But yeah, it's a thing. Now, I want to say something about infant poops, around the idea of, oops, did not take that off there, around constipation. There are a lot of diagnoses from lay people and from healthcare people about infants being constipated. Again, it is very, very unusual for infants to be constipated. Can it happen? Are there some conditions? Yes, of course, but we're often looking for other things, et cetera, et cetera. The story often is, a family comes in and they say, well, our little baby has trouble with constipation. I say, okay, what makes you say that? Well, we went to the emergency room, we went to the urgent care, whatever, and we said, oh, our baby's not pooping, and we're told to do all these things, including rectal stimulation, right? Like take a rectal temperature, that little stimulation's there. Give them a glycerin suppository that's prescribed, right, that lubricates things, et cetera, et cetera. And you have these families sitting there doing all these things. I want to tell you right now, those are almost never actually necessary. So let me tell you why. First of all, one, I always ask families, you're saying your baby's constipated. tell me why. Tell me what you're seeing or what's going on. Okay, because constipation is an interpretation. Tell me what you're seeing. Sometimes they say, well, they haven't pooped in 5 days. Okay, as we just established, are they exclusively breastfed? If they are, that's actually normal. And by the way, baby's comfortable, doing fine, feeding fine, no issues, right? Okay, mere lack of poop, especially in an exclusively breastfed baby, not an issue. But what I often hear is, well, they're grunting, they're straining, they're sometimes even crying a little bit. So they must be constipated. I say, okay, tell me what you're seeing in the diaper. Is it hard stool? And almost every single time the answer is, well, no, it's actually yellow and soft. Say, okay, I got news for you. They're not constipated. And say, okay, but why are they doing all this? I'll tell you why they're doing all this. Here's the thing. To be able to poop, we got to do two opposite things. Okay. And all of you are probably now sitting here thinking about pooping, right? You have to take the anal sphincter, the ring of muscle around the anus, and you need to relax that so poop can get out. And then your abdominal muscles, you're tensing them up so that you're pushing kind of from behind, right? And that pushes the poop out. So you're relaxing one set of muscles and you're tensing the other. Those are two opposite actions. And a young child will tense everything up so the poop doesn't go anywhere. Then they'll relax everything. The poop doesn't go anywhere. So they start trying. They're trying to figure out how to get it right. They're trying to figure out how to poop. And that's why you'll hear these grunts and little moans and this whole production. And then what comes out? Soft poop. If it's soft, it is not constipation in young children. Older children, can you get constipation bad enough that you actually get liquid stool leaking around it? So it almost seems like light diarrhea, and that's actually constipation. Yes, you can. That's our problem to figure out. So, that's a different story. But yes, this infant thing that I hear about over and over and over is not constipation. They do not need rectal stimulation. They do not need glycerin suppositories. They do not need laxatives. They do not need a GI evaluation. They simply need to be left alone. They'll figure it out. If you want the fancy term for this, infant dyschezia. You can throw that around at a pub quiz or parties, and people will be very impressed. But yeah, I tell parents, your infant is trying to learn how to poop. This is completely normal. Don't worry about it as long as what's coming out is soft. So, pretty rare to see constipation in infants. All right. One of the things to remember is what we as grown-ups control is not a whole lot. It's pretty much what goes in that kid's mouth and not much more. And I think we all know, even that's a struggle, right? You can't force a child to eat some things or whatever. There's only so much you can do there, and so on. So much about the gut changes with us being able to do little about it, right? Differences in the bacteria populations in our gut, um, small changes in digestion, et cetera, et cetera. We don't have the ability to change those things so easily. The only thing we can really change, as caregivers, is what we put in one end. So even if you're absolutely consistent about what you're putting in one end, what comes out the other end might be different, right? And that's okay, because I think that often really throws people off. Now, two sort of opposite things are antibiotics and probiotics, and these can, of course, affect the gut in different ways. Antibiotics kill bacteria, not all bacteria, and it depends on what bacteria we're talking about, and it depends on what antibiotic we're talking about. And that can, but is not guaranteed to cause diarrhea or other things. So just know that. Um, we should be judicious about our choice of about our use of antibiotics and not just go throwing them around for a whole host of reasons, including side effects like diarrhea, um, increasing the risk of allergies with those exposures, and also just messing up the microbiome, right? The bacteria that are living in the gut as well. That's largely our problem since we're the ones prescribing them. But I said not yours so much. I don't think this happens much anymore. It used to happen years ago, and I hope it's not out there, but please don't demand antibiotics for a kid to be able to come back. If they've been evaluated by a healthcare practitioner and they're like, yeah, this doesn't call for antibiotics, please respect that, and not put parents in a hard place there. Um, So that's antibiotics for you. I want to say a few words about probiotics. Probiotics are one of those things that many magical things are said about, and the evidence is all over the place, and they don't do as much as people think they do. Part of the issue is that not all probiotics are the same. So if I open a research journal and I find a really great study about this particular probiotic containing Lactobacillus GG helps with X condition. Okay. Except if I send you to the drugstore to go find probiotics, are you getting the one that has Lactobacillus GG? Are you getting the one that has something else? Are you getting how long has this been sitting on the shelf? How active are they? Right? Because probiotics, you're giving live bacteria to the body and trying to repopulate the gut there. Um, there's no standardization out there. So it's very hard to say for sure, oh, if you take this probiotic, you will have this effect. It goes all over the place. It can also be very individual. Even in research trials, they've found, well, some people seem to benefit from this kind of probiotic in this condition, but others didn't. So we're still trying to work that out. So people are often going and throwing around probiotics and all. And it's just hard to give a meaningful recommendation from a healthcare perspective because they also some of them are really expensive. So let's not overdo it and kind of um, uh, tell people they should be doing this or else. Personally, if people want to kind of add back in some live bacteria, especially if their kids on antibiotics, I tell them to go find some yogurt that has live and active cultures. It's cheaper, probably tastes better, easier to find, et cetera, et cetera. But if somebody says they want to do probiotics, I'm also going to say in almost all people, they're not harmful. Um, it's not likely that they'll cause any problem. It's just, man, some of them are really expensive. So I don't want people going and spending on money on something that we can't solidly say is actually helpful for them in different ways. All right, when kids have these kinds of symptoms, though, lack of appetite, nausea, maybe even vomiting, stomach ache, complaining of cramping, these are signs that the gut is unhappy. And because we can't see the gut, I think we sometimes think of it differently. But think about any other part of the body that's not happy, right? Let's think about something that irritated the skin on your hand, and maybe it's like a poison ivy, right? It's red, it's raw, maybe the skin's sloughing off, etc. The same sort of thing happens in the gut when it's dealing with a viral infection. Or think about the nose when we have a cold, right? Things that get red in there, there's mucus being secreted, it feels uncomfortable. The gut is no different in those ways. So the gut is unhappy when you hear about these symptoms or you yourself experience them, right? You don't want to eat anything because your gut is saying, hey, can't handle digestion right now. I know my job is to digest. I can't deal with it. Um, Throwing up, the cramping, all that. This also means, please, please, please listen to the gut. Countless parents come in saying, well, he's not wanting to eat. She's just not eating. She's drinking some fluids, but she's not eating. How do we make her eat? I say, your child's gut is saying, we can't deal with this right now. So please listen to the gut. You wouldn't say, oh, my child twisted their ankle, but they're not walking. How do I make them walk? No, you'd be like, my goodness, the ankle needs to rest. We need to get you on crutches, lie down, here's some medication, whatever the case may be. All of these are possibilities, right? Don't force the gut the same way you wouldn't force a sprained ankle in the same way. Now, if it goes on too long, of course, that might be an issue. Um, Generally, we're not seeing kids become malnourished. They can go actually a few days without eating. Um, Without drinking any fluids is much less. So we want to make sure they don't get dehydrated, etc. But again, small sips of water over time can usually, keep them reasonably hydrated. And remember, some fluids are more like foods than they are drinks. So like milk is a great example. Milk contains fats and proteins and sugars and all that stuff. It takes much more time to digest than like simple water. So, hey, if a kid is happily drinking milk, let them rehydrate with that milk. That's not a problem. But if they have been nauseous, vomiting, appetite's off, don't force the milk if they don't want it. Just go for those small sips of water and things like that. And again, seek care if need be. Time is the best healer. Okay. Just like that skin on from the poison ivy is going to take a little while, or that sprained ankle is going to need some time to heal. The gut needs time sometimes to just rest and kind of get back into shape and recover from all these things. You can, by the way, get a temporary lactose intolerance, even in young kids when they've had a recent infection, but that doesn't last too long. So, given I told you that kids don't get that, there's a temporary one that can happen. All right. Last few things. Because it's often associated with diarrhea, I want to just mention diaper rash. Um, Diaper rash falls into two categories. There's contact or irritant dermatitis. Basically, something is causing the skin to get irritated. In this case, it's liquid stool. It's diarrhea stool that's causing an irritation, and that's the problem. The other type we commonly see is yeast dermatitis, which is where yeast has kind of taken hold on the skin and is causing some irritation. Figuring out which one is which is largely our problem, so you can leave that to us. Often the yeast ones tend to be more in the skin folds, and the contact ones are outside the skin folds, which is where the diarrhea is coming up against it. But it can be hard to figure out. If it's yeast, then often we'll prescribe a prescription antifungal, but let us figure that out and sort it out. If it's contact, the main thing is to let the skin heal. So anything you can do to keep that diarrhea, if they're still having diarrhea, from touching that irritated skin where those top layers of protective layers have gotten broken down, large amounts of Vaseline, A&D ointment, there's multiple creams. All of these, the goal is to kind of just protect the skin and let it heal, and keep that diarrhea away from it. Sometimes if the diarrhea is bad enough, and you can't really do this in a early childhood education setting, but parents could do this at home if they're willing to put up with it, is to actually take the kid's diaper off. They might be cleaning up diarrhea, but that diaper is keeping that liquid up against them. The joke is if there's no diapers, there'd be no diaper rash. You rarely see this in a kid who's toilet trained, right? For the same reasons. So, you have to work with the situation as you can. All right, when should you be concerned? If you're seeing blood in the stool, notice I said concerned, not worried. One time blood, a couple of times blood may not be anything. It may be a small fissure in the anus that, we can find. Great. And that's the case, we have some recommendations on that. We'll share with the family and go on. But if the blood's coming from somewhere elsewhere, then we need to look into it. It still may not be a big deal. Literally last night, I was working in urgent care. Family came in with their about 1-year-old who had blood in the diaper. Brought the diaper in a Ziploc baggie and said, sure, got some gloves on, gave me the diaper, opened it up. Okay, I see what you mean about the consistency and all that. It looked okay to me. It was different from what the child usually got, but different. And I said, oh yeah, I see a few little flecks of blood there. Yeah. The story with that kid was they had just moved to cow's milk, as they should at 12 months. And I suspect this is a cow's milk protein allergy. So we're having them stop that for a little bit, see if it goes away, restart it. If it comes back, then you got your answer. And then we can sort it out there in terms of other options. Diarrhea for many days. Okay, much like many other viruses, things can go as long as 10 days, maybe even a touch longer. But if they're continuing to have diarrhea for many days, then okay, that's our problem. We need to figure that out. Abdominal pain that's bad enough that the child does not want to participate in usual activities, right? Doubled over, really seeming unhappy, right? Whatever the cause is, right? That probably deserves at least a call to healthcare, and potentially evaluation, right? Even if they don't have diarrhea or constipation or whatever the case may be. And by the way, constipation can cause really bad pain, like really bad. I've been fooled even myself sometimes by kids who I'm like worried that they actually might need a surgeon, and you get an x-ray and it's like, oh, there's a lot of poop in there. And thankfully nothing else that's concerning. So, all right. And don't forget, follow good hygiene when changing diapers or if clothes got stained with poop, if there's diarrhea or something like that. Best guidance, two things for you. One that I can offer you now is this Caring for Our Children Standard 3.2.1.4. Just if you type that into Google, it'll come up, or there's the link for you as well. And this kind of walks you through all the steps. I think many of you are probably familiar with this, but it never hurts to review. We also at ECHC are developing a small summary guide to that as well that you can print out and hang next to your changing stations or things like that. All right. That's the world of poop. Oh, and I got to make sure I don't forget before I go to Q&A. Remember I talked about bacteria. It is a lot of the components of poop. E. coli is one of the most common bacteria. And just for you folks, I actually wore my E. coli bow tie. You probably can't see it, but these are actual photographs of E. coli that they changed up the color to make it into a nice tie. Yes, indeed, I do own that. All right, let's go to some Q&A. I see one in the chat here, the difference between milk allergy and lactose intolerance to milk only. Yep. So again, lactose intolerance simply means you are unable to digest lactose, and that lactose goes to the gut, and the bacteria say, awesome, thanks for sending us the lactose, and multiply and create gas and all that. Lactose can also hold on to extra liquid, so you get looser stools or maybe even diarrhea and so on. It's not an allergy, it's not harmful, it just might be uncomfortable if you have a significant lactose intolerance. Allergy means that your body's immune system is actually reacting to the milk proteins. So forget the lactose, it's the proteins that it's reacting to. And that can cause inflammation throughout the gut and maybe even the bleeding that we talked about. So they're two completely different things that are in play there. I see a question in the Q&A, and remember, you can do either the chat or the Q&A, asking, is diarrhea contagious and is it airborne? So there's lots of causes of diarrhea, right? Diarrhea is a symptom, much like a runny nose. A runny nose could be due to a cold, it could be due to sinus infection, it could be due to allergies, it could be due to cold air if you just came in from the cold. It's a symptom. If the diarrhea is infectious, which most are, and if it's a viral diarrhea, yes, it's contagious. This is why we tell you to do good hand hygiene when changing diapers and so on. And soap and water is the best because some viruses, like norovirus, which you may have heard of, can be extremely contagious and actually are not as affected by hand sanitizer as as they are by soap and water. So it is contagious. Are they airborne? No, no. It has to be direct liquid, and it's pretty rare that the diarrhea is actually spraying into the air. If you have that happening, then you got big problems. But yeah, generally not airborne. There's some conversation about whether somebody has diarrhea, goes to the toilet, and when they flush, are we getting plumes of droplets in the air? Yeah, no one's ever really traced an outbreak to that sort of situation. I would not spend my time worrying about that. All right, I see another question here, which is, at what point should we send a child home? And I'm assuming that is a question more about diarrhea than it is from anything else. So first of all, if the child is acting not right and they seem to need a lot of care, right? They seem to be holding their stomach, they're not wanting to participate. They just look sicker to you. That alone, I don't care whether it's diarrhea or constipation or even not gut related, right? That's where going to the Caring for Our Children guidelines and saying, yeah, what are all those reasons that we might have to send a child home? They're just not wanting to participate, they seem uncomfortable, etc. Follow that. For diarrhea, Caring for Our Children specifically says, and I'll just quote this to you, no exclusion if the stool is contained in the diaper, if there's no toileting accidents, and there are no more than 2 stools per day above normal for that child. Okay, this helps us avoid oversending kids home, like my son all those years ago, from some loose stools that were really not an issue. By the way, as soon as he moved to the next room, the calls to send him home stopped. Those teachers were interpreting his stools differently and appropriately. So I later became their health advisor, and we got to do some education with that center about that. So it was good. That might have been my first time ever doing early childhood health consultation. Yeah, no exclusion of stool is contained in the diaper, no toileting accidents, obviously depending on the child's age, and no more than 2 stools per day above normal for that child. By the way, bacterial diarrhea is a thing, like Salmonella, Shigella, etc. They're usually pretty sick. They often have a fever, and there's often blood in the stool, right? You're probably not going to sit on that for too long. All right, I'll take one more question here that I see, which is, can teething really cause diarrhea? Nope. Those of you who are regulars on our webinars or our podcast will have probably heard me go on about diarrhea, about teething. There is no connection between the gums and what's coming out the other end. It is probably a viral diarrhea that is very common in young kids because that's what young kids do. And the whole thing about teething causing anything, teething probably causes almost nothing, to be honest. We have no scientific evidence that it's even a thing. Here's why people claim it's a thing. The first tooth erupts around 7 months of age on average. Also around that point is when babies lose that passive immunity they got from their mother across the placenta late in pregnancy. So they start getting all these coughs, colds, diarrheas, etc. And it goes on from there. So that's that. I will answer very quickly the 2 other questions that I see here. Child that's 14 months old was getting regular milk, always having bowel movements and a bloody rash. Is that a sign of being allergic to that milk and maybe needs lactose-free milk? That is something that I would recommend you talk to your child's healthcare provider about, because there can be a number of different things in play there. It could be, but it could be other things as well. And I do see a question asking about the training in Spanish. We want you to know that we really do want to make sure that we have Spanish language interpretation in these webinars. We had that going, and then the folks that we were working with on that had some staffing changes and were no longer able to provide those services. We have to go through a lot of state purchasing contracts to be able to line up someone else. We are actively working on that, and we'll have that back in place soon. Thank you for your patience. It's actually something that I'm not happy about, the fact that the interpretation had to go away for a little bit. We will get back there. All right, with that, we will take it to our close here. And Maria, I'll let you take it away.
Great. Thank you for everyone's engagement during today's webinar. As we wrap up our time together, we'd just like to highlight a few of our program services. So in addition to our monthly webinars such as this one, we also have an on-demand resource library with both print and video resources. In fact, we even have a health policy template that is available on our website. We invite you to also tune into our podcast titled Teachers, Toddlers, and Tissues, Exploring the Sticky, Icky World of Early Childhood and Health, as well as our tailored health consultation services. So our tailored health consultation services are rapidly expanding across the state with the aim of statewide support. As you see this plum color progress across the state, you can see the expansion of those service communities. If you are interested in seeing specifically which communities are within the areas for health consultation services, we invite you to go to our website. Feel free to join us for our next monthly podcast episode. But until then, check it out. We have 11 different episodes within our collection. In fact, our 4th episode was titled Poop Happens. So if you want to learn more about poop, feel free to listen and subscribe using your favorite platform. Save the date for our future monthly webinars. You can learn more, and future registration links will become available on our events page. There's numerous ways to reach us. If you have any follow-up questions, feel free to give us a call, text, email, website, and you can also follow us on social media. Special thanks to the many early childhood providers who offer us ongoing guidance, including our very own group of advisory board members. We'd like to thank our colleagues from other childcare health consultation programs across the United States, our current project partners, and our past project team members. So as we wrap up our time together, I'd like to direct your attention to the Zoom webinar chat. That's where you'll find the post-webinar survey link. This link is where you will enter your information if you are interested in continuing education credit with the Wisconsin Registry. The link is also a great place for you to share any feedback and ways that we can improve future webinars. Then following the event, you will receive a link to today's webinar recording and a copy of the post-webinar survey link just in case it's needed. And then within 2 weeks after today's live webinar, any attendance from the live session and information entered through the post-webinar survey link will be entered directly with the Wisconsin Registry by our team. Okay, just one more time, direct your attention to the chat in case you missed it for any live webinar attendees. And with that, I will turn it back over to Dr. Navsaria for closing remarks.
Thank you again, Maria. Thank you all for attending. We appreciate you and all the work that you do. And thank you for all the lovely thank yous and comments in the chat. It always makes us feel good to know that we're making a difference for you. And feel free to write to us comments, complaints, compliments, or if you have questions, we're here to try to really help everyone understand what's going on with kids and health, and all of us do a better job. Thanks again. Take care.